is very nearly upon us. When does it start officially? Is it the 1st of December? Traditionally, of course, it's a time when our health service comes under intense pressure. So we wanted to find out how prepared our paramedics, our hospitals, GPs and pharmacists are for the months ahead. After 8 o'clock this morning, we'll be live in Cumbria's newest healthcare centre as we chat to staff and we hear from patients as well. Our reporter Helen Richardson has been taking a look at just how prepared Cumbria and the wider region is.
So we know this time of year is busy for the health service. Winter brings with it every year a rise in coughs, colds, flu, COVID, of course, circulating too. It's a tough time of year for people with respiratory issues. And then added to that, we've got issues with the weather, of course, slips, trips, falls, all of this on top of the usual everyday demands on the NHS. Winter, though, of course, happens every year. It's never a surprise, let's be fair. So we wanted to find out how the different parts of our NHS are gearing up for increased demand.
Let's talk about flu first then, Helen, because we're expecting, aren't we, a tough flu season?
That is right, yes. There's a particularly nasty strain of flu doing the rounds this winter. That's because the virus mutated over the summer. It's pretty unusual. It means the flu season started about a month early. Now, cases are expected to spike this week, and the message is to get your flu vaccine if you're eligible. Dr. Alex Kent is a medical director in the northeastern Cumbria.
We're already seeing high levels of flu circulating, and we're seeing hospitalisations as a result of flu. So, we're worried about it. The vaccines are available free of charge for a large proportion of our population. So over 65s, people with health conditions, people who are in nursing homes or are carers, and also for children.
Now, the NHS is advising people to consider using a pharmacy first this winter to ease pressure on GPs. More pharmacists are now able to prescribe medicines like antibiotics for things like shingles, for urine infections, children's ear infections. So you can pop to your local chemist rather than trying to get a doctor's appointment.
Here's a question for you though, Helen. How are our hospitals getting ready?
Well, it's a mixed picture. Some hospitals in the region are trying new things this year. It's fair to say that for elderly patients in particular, time in hospital can put them at a bigger risk of falls, infections, that kind of thing. So here in Cumbria, there is a new service that's running to try and keep some adult patients out of hospitals and monitor them at home instead. Now, it's called Hospital at Home, or otherwise known as virtual wards. Brenda Stalker is one patient who's getting treated at home in Carlisle.
I'm not knocking the hospital, but if you don't need to go in and you can manage, this is much, much easier. You're more comfortable at home. You can sleep in your own bed. You can make a cup of tea when you want. If you don't feel well, you can phone her up and that's sorted.
Now, on Steph's show this morning, John's going to be live at Carlisle Healthcare's new health centre. He's going to be talking to one of the GPs there, as well as some of the healthcare assistants and a community pharmacist as well. We'll be talking about the pressure GPs are under, as well as getting some advice as well on where else you can get medical help from. And we'll be talking about the importance of getting yourself ready for winter by having those vaccines if you are eligible.
Our reporter Helen Richardson. Now, we are dedicating a whole day looking at the NHS today here on BBC Radio Cumbria. We're doing that, as we've mentioned, ahead of its busiest time of the year. And you can hear much more about that new service to keep adults out of hospital in Cumbria within the next half an hour.